Good evening, everyone, and welcome to SCOTONOMICS episode 57. The first thing I'd like to do tonight is to welcome my co-host, Karen Van Sweden, onto the show. Hello, Karen.
Hello.
I hope everyone can hear me okay. My throat's a little bit sore, so I'm speaking a little bit quieter than normal. How's your week been so far, Karen? I see there was big news today, if we can call it news. Gordon Brown has come up with some, I'm sure, ingenious proposals for some new form of devolution.
Yeah, absolutely. And it's a report that he's been working on for 2 years and it was published today. So yeah, it's again, more promises from a position of non-power. And, we've heard it all before. So I think that, people are not going to take them so seriously. I mean, it's very clear to me that Gordon Brown is very against the House of Lords, but it's not so clear that Keir Starmer is against the House of Lords because they're talking about reform in the second term. That's provided they get a second term. But then also as well, one has to remember that the current leader of the Labour Party has taken an establishment gong and is Sir Keir Starmer.
So was that one of the proposals was around at some point looking at the House of Lords?
Yes, but
Yeah.
that has been in the Labour manifesto since their inception.
Yeah.
So that's 110 years.
Yeah. Okay. Well, I don't think it sounds like anyone's particularly surprised by that. We're going to speak about poverty, austerity, and also inequality. From a quick scan of that, was there anything in that kind of report that acknowledges the huge systematic fundamental issues with Britain and the British state?
So to be fair to the report, they are talking much more about decentralisation. And I think they realised that really they should have tackled that when they were in power the last time. But to be fair to the Labour Party, and, I don't particularly enjoy being fair to the Labour Party because I think they let the working classes down fundamentally. I think when they got in after the Conservatives, after the last time, they had so much to sort out, and they did bring about devolution. They did do some good things. There's no doubt about that. So it's they'll have a lot to do again.
Yeah. I suppose it is I doubt it's gone this far, but a way to keep the kind of take the sting out of the independence movements is to kind of bypass the nation state and to start delivering much more power to where people want it, because a lot of people are looking at independence. I know you and I share this view as independence as a way of disseminating power to lower down the governmental chain to the people who really need it and who can use it. But yeah, I would imagine it's still wrapped up in that very much Westminster is control, but here's little bits of scraps from the table to allow you to make those decisions. That's without reading it, of course, which I shouldn't really say. Well, someone's just said it's a rehash of Brown's proposals with a few carrots thrown in. It'd be interesting to see how much coverage it gets. And whether we all think it merits that coverage. Well, tonight we are going to look at inequality, austerity, and poverty, and I suppose through the frame of kind of mental health and the impact that it has on individuals, society, and the economy. It was a fascinating interview we had with Tom. It was only just over a week ago now when we had that, and I've been thinking about it almost every day. So I really hope you enjoy it. Tom's based in England. We asked him a little bit about Scotland at the start, but obviously his views and his opinions would cover the whole of the United Kingdom. So I hope you enjoy it. And before I let you watch the show, just to say thanks for everyone who's watching. We've got people on Twitter, Facebook, and also on YouTube. And we'll see you briefly at the end. Anything you want to say, Karen, before I roll the video?
No, just I think this is a really interesting guest and lots of different experience from the civil service then to the front line of the NHS. So, a lot to say, a lot of interesting things to say.
Yeah, I hope you enjoy it. Hello, Tom Pollard. Thanks so much for joining us on SCOTONOMICS.
Oh, thanks for having me. Look forward to talking.
After studying at the School of Oriental and African Studies, you were planning a career in international development. However, working for an MP in Parliament. Who was that MP? Would you mind telling us?
Yeah, it was Lynn Jones, who was a backbench Labour MP. She stood down, I think, 2010, 2012. But yeah, she'd been an MP sort of since the early 90s, and I was sort of working for her at the tail end of her time in Parliament.
Okay, fantastic. And then you said that brought you into kind of close contact with the politics of mental health, and also that having personal kind of struggles with mental health, that was an area that you really wanted to look into. So it's going to be a fascinating chat for us. We're really delighted that you're able to join us to talk about these issues. And we start about talking about the levels of poverty, inequality, and mental health that you see as someone who helps to develop policy in these areas.
Yeah, so I think what we've seen over kind of the last 10, 12 years is kind of poverty creeping upwards from around 2010. And when I'm talking about poverty here, I'm talking about kind of the standard relative measure of poverty. So people being on 60% of the median income. But yeah, creeping up over the last 10 years after, generally reducing during the Labour years. And then you get this kind of weird, massive drop, essentially, in the kind of standard measures of poverty during the pandemic, partly because benefits were increased significantly, and partly because the median income dropped because of people going onto the furlough scheme or falling out of work. So on the whole, we've been seeing poverty increase, and we don't have the kind of latest figures for kind of post-pandemic yet. But the suspicion is, because a lot of that stuff that was put in place to support people during the pandemic was then taken away, like, most importantly, the £20 uplift to universal credit, that we'll see kind of numbers returning to similar pre-pandemic levels. But obviously poverty is a complex thing in the sense that, relative poverty is one way of measuring it, but there's other interesting things or worrying things going on, such as a significant rise in the number of people in deep poverty, which is a kind of measure looking at 40% of the median income rather than 60%. And lots of poverty in work now, whereas previously it would have typically been people on benefits who are in poverty. So it's not just kind of the headline rates, it's about digging underneath that and trying to figure out what's going on, and particularly that deep poverty rates of people who are really on very low incomes that aren't enough for them to meet their basic needs, which I suggest is why you've seen surges in things like food bank use over the last 10 years as well. So yeah, some really worrying signs, and I think what we'll see when we get the data kind of post-pandemic is that things are just as bad, if not worse, as they were pre-pandemic, particularly with the high levels of inflation that we've seen.
I read that you're also doing some actual research in the food banks as well, to get a feeling for how this is affecting people's mental health. So do you want to tell us a bit more about that and what effect that's had on you as well?
Yeah, so this is some work I did. I spent time in food banks around this time last year, actually, and it was with an organisation called the Independent Food Aid Network, which kind of helps to support a network of food banks that are affiliated to them but are not kind of run by that organisation. So unlike the Trussell Trust, which kind of is the biggest network of sort of centrally coordinated food banks, there's probably another sort of half of food banks that are independent, and they often come under this banner. But the work was with them and with the Joseph Rowntree Foundation. And essentially the idea was just to go in and talk to people in food banks and hear in their own words what had been going on, how they'd ended up there, but particularly the impact it had had on their mental health. And I'm really interested in, having gone from kind of working on these issues at kind of policy level. I spent a long time working for the charity Mind. So I was thinking about mental health, but through the lens of benefits and employment and debt. And then I spent a bit of time at DWP advising them on mental health, Department for Work and Pensions. And then after that, I decided to retrain for frontline work. So I spent a couple of years from about 2018 retraining as a mental health social worker. And I've been interested since in kind of combining those two perspectives, I guess, and skill sets. So thinking about situations where I can go in and talk to people about, in quite a level of detail about the impact these things are having on people's mental health and the role that mental health plays. And it was just rife in, the mental health in the food bank that I went to. Mental health was such a prominent issue. I mean, even people who weren't kind of formally diagnosed as having a mental health problem, everyone spoke about just the kind of emotional and psychological impact of struggling to get by day to day, and food bank staff also talking about the impact on them of seeing people in such kind of desperate need. It was really moving, and very, very sad that people were kind of just scraping by. And inevitably, I mean, we know that poverty has a significant impact on mental health. And inevitably, if you are struggling day to day to make ends meet, the stress of that, but also just the kind of lack of space for joy and, you know, the nice things in life get squeezed out when people are just having to fight to survive. And people, were very low and talked about, you know, feeling suicidal and taking medication for depression, which may well have helped them, but ultimately, the big driver of that poor mental health was their social and economic circumstances, and that's the thing ultimately that needs fixing. Yeah,
I mean, also, when you're in those circumstances, there's been quite a lot of research on this as well. Michael Marm looked into this. So you're always having this low level of cortisol on a physiological basis, and then you're moving into damage to your I was going to say your architecture, which is quite often how I think about it, your physical architecture, through this constant low level cortisol release all the time.
Yeah, absolutely. I mean, I'm talking
on the National Health Service down the line.
Yeah, no doubt. I mean, I remember talking to people who, I sort of start to touch on the issue of mental health, and they say, "Oh no, I don't have mental health problems," and they'd be like, "Well, I can't sleep at night because I'm worried so much, and I'm getting headaches all the time," and so for some people, it was just like you could see that the warning signs were there, but they didn't think of it as a mental health thing because it was just the struggle of day-to-day life. But you're completely right. I mean, it's not good for someone to be living in a state of stress, and it's not just kind of, the most important impact is no doubt the impact it has on kind of people's long-term mental health, but it also massively impacts on people's ability to do something about the situation they're in. I mean, there's really interesting research in a book I'm sure you guys are aware of called Scarcity, which basically talks about just the impact of not having enough money to make ends meet, and how it basically means that your brain can't really think about anything else, and it's very hard for you to look beyond really short term, how do I make ends meet, and it really limits your ability to think beyond that. And there's lots of quotes in the report that came out of the work in food banks where people were just saying, I can't think beyond today, and just trying to get through today, especially when people have kids and they're thinking about how to make sure their kids are okay. And I'm really interested in this idea of, so often the way the debate around kind of income and benefits and stuff has been framed is the idea that, like, it's all been about incentives, and the idea that, if you give people too much money, they'll be disincentivized from doing things. But I think the part of that debate that's been completely neglected is the impact of not having enough on people's ability to do things. And actually, if people are below a certain level of income, I just think it has a fundamental impact on their ability to do the types of things that might in the longer term help them to get out of that situation. And actually just giving people a bit more money might be the thing that frees them up to not have to spend all their day, worrying about where the next meal is going to come from, or chasing other forms of income and kind of getting stuck in the labyrinth of the benefit system. I do think there's a lot to be said for just give people some more money and then, give them the space and, headroom to try and address some of the issues they're facing.
On a macroeconomic level, if you've got lots of people who, their imagination is restricted by this low level stress or high level stress all the time, then they're never going to fully actuate into who they can be. And then, that's a resource for a country that's completely lost. It's never ever discovered or found or added something to the economy. It's just so tragic. And from the point of view of this conservative thinking about this kind of harsh father type politics that they tend to go for, it's so actually it works against the economy.
Well, and also I think what's interesting about it is that people struggle to recognize the extent to which having a degree of security has enabled them to do the things that they've done. So even if you have worked very hard and you have achieved great things through hard work, it doesn't half help to know that if you take a risk and try and do something and things don't work out, you'll probably be okay financially. Even in my own career, I've sort of jumped around doing a whole bunch of different things, and part of the reason I've been able to do that is because I've got some degree of financial security and support from wider family, and I sort of know that if I took this gamble and things didn't work out, that I'd probably be okay. And I've been fortunate enough to have a good education and all those things. And I just think we massively underestimate how much those things kind of provide, to come back to that term architecture, provide this kind of scaffolding in people's lives, but we can't really see it because it's just normal. It's just normal for us. And so we get these debates around like, well, if someone didn't, if someone was given more money, they had no incentive to work. And it's like, well, I don't know, like you've worked your whole life and gone on to do interesting things, in part because you've had that kind of basis and that foundation beneath you, and it didn't disincentivize you to go and work, even though you may have come from a wealthy family. So why assume it would do so for someone else?
That's really interesting, and you kind of hint at the other things that people are losing when they're in financial poverty, which is, if you look at the poverty of time and also the kind of poverty of network. And I think the networks is one of the most important and underrated support systems, that when you're looking at how people look after themselves and advance. And as you said, if you're struggling and you're really thinking about where the next meal's coming from, especially where the next meal from your kids coming from, and you don't have a support structure around you, it's incredibly difficult. There was a very moving cartoon in The Guardian, I think it was yesterday, and it was a little boy sitting at a table with his dad saying to him, I really hope I can grow up to be as big and strong as you so that I don't need to eat dinner at night time. And I think that was really a really poignant, because we know these things are going on. In terms of the other areas that you're working in, how does kind of poverty manifest itself in the areas where you're working? What do you see to make it really clear, and also where is it hidden?
That's an interesting question. I mean, there's something about it kind of being hidden in plain sight. I think what's kind of interesting, and it links back to what you were saying about people kind of being isolated and not having networks. It's interesting working. So I work part-time now in mental health services in London, and then spend the rest of my time kind of doing policy work with charities and think tanks. But like when I first started doing this kind of frontline work, that you kind of dive into this world that you don't really see day to day, especially living somewhere in London where there is such stark inequality side by side, and you kind of, you see poorer areas of housing and stuff, but when you're going inside people's homes and sort of hearing the kind of lived day-to-day reality they're experiencing, you just realize there is so much going on under the surface that it's very easy to live in a place and not see. And I've described it to people who have asked about that transition from kind of policy into kind of frontline practice, of almost going from seeing things in black and white to seeing things in color. It's something about the richness of getting a proper understanding of what, being side by side with that person and getting a sense of what it's like in their life day to day, that you can't get from reading about it, I think. And I think we're getting better on that front, in that there's more effort being put into trying to give voice to people who are living through these issues rather than speaking on their behalf. And I think that's really positive. And things like the COVID Realities program that kind of gave voice to lots of people who on low incomes during the pandemic. But yeah, so there's something about this stuff kind of being hidden in places like, but also just the extent to which poverty intersects with so much else. So mental health being a big part of that, and kind of the kind of thread throughout all of it. But just the likelihood that people who have grown up in poverty may well have been more likely to experience kind of abuse or neglect in childhood, and the kind of interconnection of that kind of life course where people have just missed out on a bunch of stuff, but also had these negative experiences that kind of stay with them throughout life. Growing up in poor housing, growing up in areas of kind of high crime and where people don't feel safe and secure, all these things kind of imprint themselves on people and make it very hard for them. Even if their circumstances do change, it makes it hard for them to kind of engage with support and kind of see a way out, because people kind of get stuck in this kind of fight or flight mode. And so there's lots of interesting stuff within mental health around trauma and the impact trauma has on people long term. And I think what we're coming to see and coming to understand is that actually trauma doesn't necessarily have to be big bang life events. You know, those things obviously do make a big impact, but actually just kind of constant low level struggle in and of itself is a form of trauma, and people find ways of coping with that, but ultimately it can lead to them leading very, very kind of closed off, isolated lives. So that's kind of the thing that's really struck me over the last few years of having that kind of frontline experience.
Loki touched on this in Poverty Safari as well. And, you know, this is where I first came into this idea of adverse childhood events. And, you know, that exactly what you're saying, you know, for example, you know, constantly your parents shouting at each other because they're stressed, and how that affects you as a child. But then, of course, that's also having the same effect on the adults as well. And, you know, it's and the stresses that they're having because they're worrying about how they're going to pay for things. It's just all so toxic.
Yeah. And for me, the other thing, I mean, it wasn't a narrative I was attracted to before going into frontline work, but the idea of kind of personal responsibility and kind of almost blaming people for their situations just feels so absurd once you get up close and personal with people's situations. You know, the idea that people are kind of choosing to kind of make bad decisions in their lives or kind of being neglectful. I mean, it's just like, again, it comes back to that thing of like looking in from the outside and saying, well, you know, I think if someone's given more money, they won't bother going to work. But similarly, you know, looking in from the outside and saying, well, you know, why don't people just do this differently? Or why don't they, you know, read to their kids more or whatever it is? It's so easy to make that judgment from the outside. And once you get alongside someone and you're kind of seeing just the day-to-day strains they're under and the kind of coping survival mode people go into, it becomes really understandable that people end up kind of just ticking along and getting by and maybe not doing the things that actually might be beneficial to them and their children in the long term. But, you know, it makes so much more sense when you're alongside people, and it's so hard to kind of look up close and personal at someone's situation and then come out of it with the conclusion that, well, you know, I blame their kind of lack of character or something. It just doesn't, it stops making sense as a kind of frame for understanding what's going on.
Yeah, and there's so much more evidence, scientific evidence about the impact of, as you said, early development and trauma. You know, and a whole kind of grey literature now around the impact of stress, and all that. This can, how difficult it is to turn over a new leaf, or, you know, kind of chin up, forget about it. You know, all these things that, you know, we were grown up with when we were a little bit older. There's so much more research to say that it's nowhere near as easy as that. And I think society as a whole is much more aware of that. But my question to you is, a way that a lot of people who are in poverty interact with the state is through the benefit system. Is there any way, and, you know, and I think, you know, hopefully we could maybe cover the Scottish benefit system being different from what's happening in England, but is there any way in which the benefit system is reflecting this wider understanding of the difficulty for people who are trying to access benefits, or is this just a little island off on its own?
I mean, I'd certainly say there's a long way to go. I mean, the only real point of distinction, I guess, you get in the benefit system where there is a bit more recognition of kind of the complexity and difficulty people might face when living in poverty is around health and disability. And, you know, it's far from perfect, but there is some recognition of that built into the system, to the extent that people who are seen as being unable to work because of poor health, most of them get an additional payment on top of the kind of regular base amount of benefit. And also there's not the same kind of requirements and expectations and threat of sanctions for not working. But that system is, you know, so far from being supportive. I mean, most people who interact with it find it very stressful and intrusive, and often feel that the impact of their health conditions and disabilities aren't fully recognised, and you know, the amount of money they get doesn't reflect their needs and what they need to make ends meet. And you know, I think there is something really interesting going on around this intersection of health and poverty and employment. You know, there's been a lot of focus in recent months on rates of economic inactivity, as it's called, which is basically people who aren't in work and aren't expecting to go back to work anytime soon and aren't really looking for work. And there's a whole bunch of reasons why that happens, but the one of the biggest ones now is people who feel they're too ill to work. So that's about 2.5 million people. And there are similar numbers within the benefit system who are not expected to work because of illness or disability. So it kind of maps across, but that's been growing. And the proportion of that which is related to mental health has been growing a lot as well. And I do think there are a lot of people, and it's spiked a lot post-pandemic, or sort of during and post-pandemic, and there's been a lot of interest in how much of it might be about long COVID and NHS waiting lists. But I think the thing that's kind of underplayed in all of this is just the kind of toxic interaction of poverty and poor health, and the kind of impact that has on people's kind of identity and sense of kind of self-efficacy and control over things. And I think, you know, the response we get is, well, if we just cut NHS waiting lists and could do something about long COVID, we'd sort this out. And I think there might be something in that. It might well help, but you're not going to kind of get to the kind of majority of that 2.5 million group by kind of quick fixes. It's going to be about understanding that deep, complex interaction between health and poverty, and inequality, and like access to kind of, you know, as we were saying earlier, networks and community and all this stuff. It runs really deep. The roots run really deep.
You touched on inequality there, and I wanted to look at that next. Again, growing up, if you're a kid or a teenager in the 90s and the early 2000s, you probably think that the UK was kind of always a country that was really unequal. And right now, the UK is the second most unequal country in terms of kind of Western northern democracies, just behind the States. The UK is the second highest level of inequality among the countries of Western Europe and North America, and it's achieved this position only a few decades. Before the 1980s, the UK's level of inequality was similar to some countries in the Soviet-dominated Eastern Bloc. So that's how much we've changed over that short period of time. In terms of inequality, Tom, have you seen things getting a lot worse over the past decade?
That's a tricky question, because I don't know how clearly that kind of manifests in people's day-to-day lives. So certainly the poverty side of it is very tangible. I think there's certainly a sense of, as I was saying earlier about working in London and where there's such stark inequality side by side, you know, it is shocking to know that people who are in some of the highest paid jobs in the country are living alongside people who are kind of on the breadline. I don't know how easy it is to kind of have a clear, tangible sense of you know, inequality changing in the short term. But I think you're right. You know, over the course of decades, it's certainly very clear that a lot of people went from being kind of relatively comfortable to being quite wealthy in this country, and a lot of people kind of stagnated essentially in terms of their living standards, if not got worse. And I think, you know, there's lots of good evidence to say that gap does matter. You know, poverty is really important, but that, you know, in terms of our mental health and our physical health, actually, and a whole bunch of other things, you know, we're all kind of aware of the kind of spirit level argument, and then the subsequent book that they wrote called The Inner Level, which focused particularly on mental health. It really matters, not just to the people at the bottom. I think there is something about all of us feeling, or those of us who are kind of maybe tuned into it, feeling this sense of insecurity to some extent, and a lot of that I think comes from this sense that we are a less kind of cohesive society when we are more unequal. And it is a kind of, I think it weighs heavily on all of us to know that there are these levels of poverty. And I think when, you know, those of us who are living in more kind of financial comfort, it's not an easy thing to kind of hold in your mind, the fact that there are people who are, you know, living in such poor conditions, especially when you kind of get to the point of not really buying into the idea that that's down to their merit or their effort, it's a hard thing to live with as a society. And I think it kind of, it's detrimental to all of us. So yeah, I think it's certainly noticeable over that longer span of time. I think it's quite insipid in the way that it doesn't obviously manifest in the way that like poverty levels do kind of year on year. But I think certainly over time we have become a kind of more disparate society, and to some extent I guess it almost leads to people, attitudes around things like benefit levels and poverty do fluctuate for various reasons. But I think when you live in a society where lots of people are relatively wealthy and then you have lots of people at the bottom who are very, very poor, and a lot of people at the top who are super, super rich, and you do have that kind of gulf of inequality, I think people do have to kind of have this story that they tell themselves about why that's okay, because otherwise it just wouldn't be sustainable and kind of, psychologically comfortable to live day to day with the knowledge that people are suffering so much. And so you almost get these narratives around the effort people are putting in. It kind of forces that, because otherwise how do we, explain and justify being in such a rich country overall where people are living in poverty? And people have been saying about the current kind of financial situation that, as a country, yes, growth might be important, but ultimately we have a lot of wealth in this country. And if we distributed it and spent it differently, then you wouldn't have the levels of poverty and destitution that you have in this country. So, to some extent, it is a choice we make as a society, and it might be a choice that's very hard for us to kind of individually to enact, but collectively, this is the path we've gone over the last 30 years, and I don't think it's been very good for any of us.
It's like a coping strategy.
Yeah, absolutely.
So probably the party that are in power just now in Westminster are not going to be looking on your research that favourably. So I would imagine you're trying to get your policy into the conferences of the Labour Party. Are you getting some traction there? Are you getting people taking up your policies, putting them forward as resolutions? How is that going?
Yeah, so in some specific areas, it has gone well. So the kind of big thing, one of the big areas I've worked on is thinking about how do you support people who are out of work because of health and disability, and often the kind of the intersection of that and poverty, and kind of stuck out of work for long periods of time, because people who are in that situation often are out of work for very long periods of time. I think there's a stat that if you're kind of in the benefits category, which basically says you're not expected to work or even move towards work because of your health, you're more likely to end up dying in while you're in that category than you are to move back to work. So and we have a huge problem in this country where we do have 2.5, if not more, million people who currently can't work because of health. So I've done lots of work around kind of what you might do to support people in that position, because there is good evidence that, particularly around mental health, given the right support, some people, even with quite severe mental health problems that might seem very limiting on the surface, can move into work. And that's about the support they receive to kind of go on that journey. But it's also about kind of the support available from employers to kind of adapt jobs and support people once they're in the workplace. And that's a lot of what I focused on while I was at DWP. But the problem is that the DWP approach to this is just so heavy-handed and so kind of sees everyone through the lens of their benefit receipt, and kind of has this standard way of responding, which is to kind of get someone along to the job centre and encourage them to write a new CV, and it's just that's not where it's at in terms of helping this group of people. So I've written some stuff around how you might do that differently, and how you might kind of form local networks of support that link in the NHS and the local authority and the third sector. And Labour are kind of essentially saying, at this conference just gone, essentially said that's the approach they're going to take for employment support. So there are some positives, and there is value in kind of chipping away at this stuff year after year and saying, oh, this isn't right, you can do it differently. I think for me, the bigger, maybe the kind of more fundamental challenge at the moment is where we go on the question of kind of income adequacy, to put it in kind of wonky terms. So basically, like, there's so much debate around the sort of relative value of benefit. So there was a lot of discussion in the run up to this recent financial event, or whatever they called it, about whether benefits will be increased in line with inflation. And to me, it's just such a kind of headache of a distraction, because it's like, it's definitely important. I'd definitely rather benefits went up by 10% than not. But the idea that that's kind of gets us to a place where benefits are now kind of generous and adequate is nonsense, because all that's doing is kind of resetting them to the level they were at pre-pandemic, which was the lowest level they've been in real terms since the early 1990s. Because
it's very dangerous, that conversation, because of the lower level that it sets in terms of people's expectations. So, you know, that discussion can seem very positive, but most people frame an increase or a decrease around some kind of level. And if that's what we're talking about, then that almost seems like a maximum level.
Yeah. Well, and it's not linked to a discussion of what people need. So no, like, it's just a kind of a floating number that says, well, it was this, and we should, you know, it should keep pace with inflation. Well, it wasn't enough before this kind of rampant inflation hit. So resetting it while it's welcome, you know, I certainly don't want it to decrease in real terms, but we have to have a discussion around what someone needs, not just to kind of scrape by, but as we were talking about earlier, I mean, we need to be talking in terms of what someone needs to be able to live in a way that allows them the kind of psychological space to be able to do the things that might help them to kind of move their life forward and improve their life. You know, because if we're giving people enough money that they can just about afford to eat, you know, that might not be the best way of, you know, getting people back towards work and kind of supporting longer term growth. So thinking about these things as like an investment in people, rather than thinking about it as kind of throwing money into a hole, which is how benefits have kind of always been framed as kind of like, well, you know, there's some people out of work, we kind of have to make sure they've got enough to eat. But actually, we could be thinking about how do you kind of really foster and nurture someone to get back from that situation. And if we move away from thinking in terms of kind of deservingness and whether they're taking enough responsibility, and, you know, let's just assume for the time being that people probably want to live a better life, and probably don't want to live on benefits, and if given the kind of right foundation and right support and right encouragement and right circumstances, would be keen to find, you know, other ways to live. And if we start from that perspective, I think we have a very different conversation.
Extrapolating this out, you're kind of talking about the whole economy. I know you were speaking about individuals there, but when we're talking about the macro economy, there are these kind of figures that don't mean anything. 3% of GDP is your debt as your deficit levels, or your debt level has to be at 60%. These are just figures that don't actually mean anything. We need to look at them and say, well, rather than look at the figures, what do we need to improve the lives of everyone in the economy? And I think your points on investment and, you know, support are all really, really important. You know, it looks similar from that individual perspective as it does for the economy.
No, absolutely. And I think, you know, so often these things that end up being kind of detached from any kind of tangible reality. You know, yes, growth is good. You know, in broad terms, growth is good, but growth can mean a lot of things, and it can lead to rampant inequality just as much as it can lead to lots of people's lives improving. And I think bringing these things back to what's the impact on the lived reality for people day to day, and also reframing some of the stuff to think about, you know, so for example, if we looked at a lot more policy through the lens of what impact would this is like to have on health, and particularly mental health, I think you'd come up with some very different solutions to, if your starting point is, well, you know, growth is good because that probably leads to everyone's lives being a bit better. Because actually what we've seen is, you know, growing inequality is poor for our health, but also leaving a whole bunch of people kind of stranded because they're seen as kind of not contributing enough. You know, it leads to horrible lives for those people, and it leads to huge costs for society. You know, we're facing, you know, we're going to see a massive increase in the number of people who are kind of long-term sick on benefits, and the cost of that is huge. You know, you're talking about tens of billions of pounds a year, which is just essentially seen as a sunk cost because those people aren't seen as, you know, being likely to move towards work, but also the cost of the health system, the cost of social care, and the kind of lost. The lost potential of people who could be living happier, more productive lives, being a more active part of their community. I just think we have such a kind of bean counting approach to some of these issues, and it's so short-sighted.
Yeah, I wrote a paper with my colleague Cameron on a job guarantee. We were quite keen on that. We feel that fundamentally, because the government taxes you, it essentially makes you unemployed until you're able to pay those taxes. And so therefore the government has a responsibility to employ you. And currently the government employs the NAIRU, or rather the Bank of England does, the non-accelerating inflationary rate of unemployment, which is the Bank of England saying it's okay to have about 3% of your population unemployed. And that's really not okay. I don't think that people should be used as in guarders, should be paid a pittance to guard against inflation, which actually that's not really working right now. We can see that. But the other thing that we want to really try and do with that is encourage people into the type of work that they really that really is fulfilling for them as well, and that you also set a bar of employment where you are paying that real living wage that then everyone else has to come up to, because if they don't, they will come to us in order to be a dream job, but they would be well looked after, they would have childcare, and they would have a real living wage, which would give them dignity. And then if they wanted to move back into the private sector because the private sector was offering them something better, then that's our thinking with that. What do you think about that idea?
Yeah, I think that general idea of trying to reverse what has essentially become a bit of a race to the bottom, unemployment, and certainly that was the kind of mindset when we briefly had the misfortune of having Liz Truss and Kwasi Kwarteng in charge. He talked a lot about how great it was when he visited China and saw people who worked 10-hour shifts and got money docked for their toilet breaks and stuff, and what a glorious thing that was. And I do think there's this real kind of like,
I didn't say that. Wow, really? Wow.
yeah.
Well, this is a Britannica Unchained narrative, isn't it?
It was all around that stuff. But he talked in really glowing terms about what he'd seen in China, and there was this kind of idea of like, if only people would just kind of work harder, and British workers are lazy. But it's like going back to what I was talking about earlier about trying to understand people by their side rather than kind of looking in on their lives. Like, I don't think people are lazy, and I think where people kind of do shy away from jobs is because the jobs are pretty grueling and horrible. And again, it's very easy for me as someone with a job that I enjoy, or for a politician with a job they enjoy, to say, well, why can't someone just go and do this job? But understanding what it's like day to day doing a job where you're not treated with dignity or respect, and the idea that kind of any job is better than no job. And we have come some way, at least in the debate around health and work, in that sense, that for a long time DWP was very much like, work is good for you, work is good for your mental health. And we were, in the sector, we were saying, well, hang on, the evidence kind of says good work is good for your mental health, and kind of crap work is worse for your mental health than being unemployed. So there has been a little bit of nuance injected into that debate. But I think you're right, that kind of trying to pull up the standards and not just seeing better working standards and kind of a better work environment as just in cost terms, and instead seeing it again as an investment, and as that actually we can have a really big impact on health and mental health across a whole range of kind of government policy. And so often we think about health just in terms of healthcare, but the reality is a lot of what I see certainly in mental health services in the NHS is people who are often ending up unwell because of a whole bunch of other factors. They might have some susceptibility to poor mental health, and they might have some pre-existing mental health problems, but often it's kind of difficult life circumstances that are really driving people into crisis. And so I think I'm definitely in favor of thinking about how do we kind of raise the bar rather than lower it, and how do we, within that, I think the tricky thing is how do we kind of sensitively support people who have got to a place where they see themselves as being unable to work. Because I think there are lots of people who have illnesses and disabilities that do make it very hard, if not impossible, for them to work. But I think there are lots of people who given better experience, might have a different view on this. That they've probably come from a job that wasn't particularly supportive and might have contributed to them being unwell, and maybe they haven't had experience of being in a more supportive workplace. And so when they're asked, do you think you could work again? The things that jump to mind are their previous job and their idea of what it might be like to kind of go through the kind of job centre machine and be squeezed out into some low paid dead end job. But if instead that conversation was about, what do you care about, and what are you interested in, and what are you good at, and how can we find ways to support you to do that in a way that would allow you to have more income and more independence, that's a very different conversation. And I just think, we kind of have such a kind of narrow understanding and response to this stuff, that there's huge potential here to support lots of people, and as you're saying, to kind of raise the bar of what's expected. But instead we're kind of left kind of grubbing around the kind of lower end of kind of, let's get anyone into any job going because that's better than nothing. And I just think it's such kind of paucity of aspiration.
There's obviously something fundamentally wrong with the system. And one of the reasons, Tom, that Kieran and I are so supportive of Scottish independence is that this is likely one of the best ways to shake the whole system. And I would include into Westminster and what happens in the rest of the UK as well, is with this kind of seismic change that happens from something like Scottish independence. If you're looking at this from from being based in England, what's the thing that makes this kind of system change? Because as you said earlier, tweaking around the edges with a little bit more benefits or a little bit less or a little bit more understanding, it's not going to fundamentally change the system, and it's clearly broken. So what are the ways to make that fundamental change?
It's an interesting one, because on the one hand, I think the kind of challenge we're talking about around kind of poverty and the intersection with mental health, on the one hand, it's very complex and complicated, particularly when you're talking about the kind of intersection with other issues. On the other hand, some aspects of it are relatively simple. When universal credit was increased by £20 a week during the pandemic, relative poverty massively decreased. So I think it's important to not lose sight of the power government does have at the kind of brush of a pen stroke to change a lot of this stuff. So I think there's something about not ceding ground on the basics. It's not generous to return benefits to their pre-pandemic rate in real terms. And actually we could do a huge amount just by having essentially a kind of minimum income guarantee and saying, let's have a proper exercise, maybe an independent body. Joseph Rowntree Foundation does some great work around minimum income standards, but let's have a proper discussion as a country and as a government about what is the minimum that someone should be expected to live on, and let's have a benefit system and employment and wages that guarantee no one ever falls below that level. And that doesn't feel that controversial to me. And I think sometimes the kind of argument that people won't go for that, I do think there's something toxic in the way these issues have been framed in the past. So if, for example, I say to you, should someone on benefits get their income increased by 10% because that's what inflation's been, but you're only getting 5% on your wages, well, that as an argument, that's fine, that sounds unfair. But if I say to you, what proportion of a minimum wage salary should someone on benefits get, so a proportion of like a full-time annual minimum wage salary, and I think most people maybe would hover somewhere around 50%, let's say, of what someone would get if they were in work on minimum wage. The reality is it's more like 25%. So I think there are different ways of talking about these issues to try to get us back to what I was saying earlier about what's the lived reality for someone, and what do we expect as a society people to cope with. And I don't think a lot of what people are coping with day to day, most people would see as acceptable. So I think there's something about being positive about the difference central government can make on these issues and how much difference can be made just by giving people more money. And I don't think that should be underplayed. And I think sometimes that we're a bit squeamish about saying just give people more money, but framing it in terms of the real lived experience of what happens in people's lives day to day, highlighting the huge costs we face as a result of poverty and inequality. The human suffering is obviously bad enough, but the huge costs across a whole range of areas of kind of public spending and public services, and talking about investing in people and investing in people's futures rather than talking about sort of throwing money into the kind of whole of benefit spend. And then I think, you know, as I was saying, it is also a complex problem, and there is lots that can be done locally. I think kind of giving local areas the power and resources to kind of create healthy communities and the kind of incentives and structures for them to do that, and thinking about, you know, how does housing, employment, health support, community infrastructure, community cohesion, how do all those things interweave? How do we create a kind of healthy, happy local community? And thinking about that kind of place-based approach to policy and support, identifying people who are at risk of poverty. You know, often people who are really struggling, sometimes it's because they're not getting the support they are entitled to because they don't know it's available, and or they struggle to advocate sufficiently for themselves to get the support they need. So there's a lot that can be done around, you know, within the constraints of the system as it is. But fundamentally, I think we need a different national conversation about this idea of what do we think it's fair for someone to live on as a minimum, and how do we make sure that everyone gets that as an absolute guarantee.
Tom, that really fascinating insight there. I wondered if you had any perspective on how benefits have been done differently in Scotland now that Scotland has a little bit more control over the benefits. So yeah, I'm obviously aware that some of those powers were transferred to Scotland to kind of have control over certain aspects of the benefit system. I don't know the kind of finer details of what's going on. One of the areas I have spoken to people about, though, is that I know they are looking at this idea of how do you more meaningfully guarantee a minimum level of income, and what that would look like in the benefit system. Because even the amounts that people are supposed to get within the benefit system often then are subject to kind of deductions and repayments, which mean that people fall below even that low level they're supposed to be receiving at the moment. So I know there's an ongoing discussion and piece of work that's happening around, you know, what should a minimum income guarantee look like in terms of amounts, but also how should it work? And you know, looking at what parts of the system that they now have devolved power over can they use to address some of the kind of overall shortcomings of the current benefit system. And I think it's great. I mean, I think there's a real opportunity. You know, that example in Scotland, the example in Wales of kind of, I can't remember the exact name for it, but essentially it's this kind of well-being framework, and the idea that I think it's called Future Generations is the kind of name they use for it. But the idea that like we should be looking at all policy through the lens of kind of inequality and poverty and health and kind of framing things in those terms. I think there's real opportunity with devolved powers, you know, and potentially, I guess, independence at some point, to kind of take a different path that is still very kind of tangible and noticeable to the rest of the UK, and show a different way of doing things. And I think what's critical then is monitoring and evaluating and really demonstrating in kind of human terms what impact that has, because I do think these things seem kind of impossible until they happen, right? So, you know, adding an extra £20 a week onto universal credit during the pandemic would have been unthinkable before that happened. You know, it would have been, you know, the equivalent of uprating benefits by sort of 30% or something. And now we're kind of haggling over whether they go up by 10%. But once it happened, loads of MPs, including Conservative MPs, were saying, actually, this is probably nearer the level benefits should be. So much of the way we talk about these issues is massively constrained by a sense of kind of what's possible and what's realistic and what's kind of adult and grown up. And I think there's something about someone just doing it and just showing that you can do it and showing the impact it has and normalizing it, that can really kind of shift the window of what people think is possible. And that then opens up conversations about going even further or doing things that, you know, building on what's been learned in those spaces. So I think it's critical to have this kind of almost like different parts of the country having some freedom to test this stuff out and kind of forge a different path and set a more positive example. Tom, thank you very much for your time. It's been a really interesting conversation, and we'll hope to see you again soon. Thanks for joining us. No, thanks for having me. Great to talk.
Thank you.
A full 50 minutes from Tom there, and loads of comments. So thanks very much for that. I hope you enjoyed what you had to cover. Karen, watching that back, any thoughts?
Yeah, just the again, the paucity of imagination of the leadership in this country, in the UK, really, rather, in the past 40, 50 years. I think it's interesting, that concept of, I think, was it Dominic Raab that went to China, and, he saw people being timed on their toilet breaks and thought this was wonderful. And, when I lived in the Netherlands, it was well known that the Netherlands had the highest productivity in Europe. And, we had so many meetings at my work all the time. Eventually I thought, this is too much. I don't need to express my feelings as often in this. But, everyone is invested in the company. Everyone feels a part of the company. And I think that that's something that a trick that's missed, and getting people to be involved and not treating workers as expendable.
Yeah, we had a couple of comments around universal basic income, and I know you mentioned the job guarantee to Tom, but these are ideas that still seem quite radical, and we've been discussing these for at least a decade. Lee McCormick has said there, I'll put this were they not trying a UBI for youngsters in Wales? So there are some of these schemes. I know there was one in Scotland as well. Can you remember what happened with that one, Karen? UBI?
I think that was in Fife. I think that was somewhere in Fife. I don't know. I'll try and find out more about that. But yes, they've been doing that in Wales for care experienced youngsters, absolutely, to get them started off in life. Yes, for sure. Yeah.
I know there was.
I think a lot of people that are keen on the UBI are really, what they want is a proper welfare system. So again, when I was in the Netherlands, as soon as you become unemployed, you get 90% of your last wage. You don't drop down from a 40 grand a year job to 80 pounds a week. That does not happen in the Netherlands. You have to gradually have to lessen your expenditures as your money goes down over a period of time, but you're not expected to go from, 40, 50 grand a year to 80 pounds a week. That doesn't happen in the Netherlands. It's really not humane.
I know that there was I read just a couple of weeks ago that if you've got more than, I think it's like, if you've got more than £12,000 in savings, then you get nothing. You get no kind of universal credit or anything for losing your job. But that was actually the figure in the late 80s, and it's not risen at all since then. So they've kept that minimum that minimum figure, and it would be round about £30,000 now. So there's a lot of people who are unemployed for a few months, and they're eating into their savings. They've worked really hard to build up over a period of time. So it is just that complete harshness. And as Tom said, it's when he went into this and started working in it, he never thought that people were trying to scam and were out for it, and he just couldn't really believe that. And once you spend time working with people who are in such desperate need, you see that there's no element of choice in this. It's all about the difficulty in the situation that they're in. So I thought it was really interesting. I know there was I said, you mentioned job guarantee scheme. There was a report that was just out from a job guarantee scheme. It was just covered yesterday, and it was hugely successful. I'll find the link and I'll put it in the comments. I'm just trying to remember now which country it was in, but it basically got rid of all long-term unemployment. It was so much better than anyone had expected. It was especially beneficial for older people, and there was one character who'd said, in his late 50s, very well educated, loads of experience, he just couldn't get a job, whereas the job guarantee gave him a really good job, and he was guaranteed that. So it's great to see that there are some things happening, and there are.
That was in Austria.
Was Austria, yeah. But it really is about looking at the whole benefit system and realizing that it shouldn't be there to punish people. It should be there to support them. And I think we got from Tom the real issues and the difficulty when that's not happening. Any more comments from any of those watching? I've brought up a few of them on screen so far. But any final comments before I head off and give my throat a rest for the evening?
Yeah, I think that this concept as well, that precarity is, and this is a very conservative concept, that precarity is an engine for people to go out there and win. And I think that comes from a place of privilege, as many in that party are coming from a place of privilege. And like even Tom was saying, he was expressing his privilege as well. And I had that privilege as well. I've moved from, done lots of different things, but I always knew that if the worst came to the worst, I could always lean on my parents if I had to. That was behind me. And Tom was saying the same thing. Now, if you don't have that behind you, you can't take risks. And that's what the welfare system is there for, to make sure that you're not going to end up in destitution when you take risks.
Yeah, there's a huge amount of evidence. We go into a little bit more detail on Patreon around the impact of inequality and on nations and the society and the economy. But there's a huge amount of research that says if you have a functioning safety net, it improves the welfare of the whole society. It doesn't make people lazy. It doesn't make people they're still entrepreneurial. They still try things, but they're more likely to try things because they know if they fail, they've actually got some kind of safety net. So this idea that you need this as an incentive for people to work, there's just absolutely no evidence of that. And it's just ideology that's unfortunately in charge of who we've got in Westminster. And it was nice to hear some positive things about the Scottish government from Tom as well. Yeah, well, thanks everyone.
I was just going to say, I mean, I really do think that it's a trickle down from the feudal system, it's a nasty trickle down from the feudal system, and we really need to kick that stuff down the road.
Yeah, absolutely, and it is as we said in the interview, it's the fundamental changes that we need, and it's difficult to see how that's done with a few carrots thrown at the independence movement from reports like Gordon Brown, which I've had a little chance to have a look at now, came out with today. So thanks everyone for joining us tonight. Next week we've got an episode on blue gold, which is a horrible thing to say when we're talking about water, but we're talking about the financialisation of Scotland's kind of greatest resource. It's a really interesting, it's a real conversation, isn't it, Kieran, with you and Jane? It's a really interesting episode. It's quite a short one. And then the following week we've got a fascinating chat with Stephen Kinsella, who's the economics professor, head of economics at the University of Limerick. And that was a really wide-ranging conversation, but the question to him was, is Ireland a template for Scotland as an independent nation? So really interesting couple of shows coming up, and then we'll be done for the year. And then we'll be back again next year. But thanks for all your support. We've already sent out some information about SCOTONOMICS Live, which is taking place in March next year, but we'll be pushing that on all the shows in the new year. We'd absolutely love to see you in person in Dundee next year. That's all from me. Good evening, Kieran.
And good evening to everyone. Thanks for watching.
Bye for now.